Here is Dr. Alfred Egedovo again from GHC Hospital presenting their Health Promotion Initiative program. Hey everyone, welcome back to our channel. Today we're diving into a topic that affects millions of people worldwide, chronic obstructive pulmonary disease or COPD. Now you might be wondering, what exactly is COPD? Well, it's a progressive lung disease that makes it hard to breathe, but there's so much more to it than just that. Chronic obstructive pulmonary disease, COPD, is a progressive respiratory condition that affects millions of people worldwide. According to the World Health Organization, WHO, COPD is the fourth leading cause of death globally, with an estimated 328 million people living with the disease. It is a chronic inflammatory lung disease that causes obstructed airflow from the lungs and leads to symptoms such as coughing, wheezing, shortness of breath, and chest tightness. Did you know that COPD is the third leading cause of death globally? That's right. And yet many people don't even know they have it until it's too late. So what are the symptoms? Chronic cough, wheezing, and shortness of breath are just a few. But here's a question for you. Why do so many people ignore these signs? Is it denial or simply a lack of awareness? Causes of COPD. COPD is most commonly caused by long-term exposure to irritants such as cigarette smoke, air pollution, and workplace fumes. Genetics also play a role in the development of COPD, with some individuals being more predisposed to the disease than others. Other risk factors for COPD include frequent respiratory infections, age, and a history of childhood respiratory conditions. And let's talk about the controversies surrounding COPD. While smoking is the leading cause, did you know that air pollution and even occupational hazards can contribute to this disease? Some argue that the focus on smoking has overshadowed these other factors. What do you think? Should we be more concerned about air quality in our cities? Symptoms of COPD. The symptoms of COPD can vary from person to person, but common symptoms include chronic cough, shortness of breath, especially during physical activity, wheezing, chest tightness, frequent respiratory infections, fatigue. Now let's touch on trends. Recently, there's been a surge in digital health tools aimed at managing COPD. From mobile apps that track symptoms to virtual support groups, technology is changing the way we approach this disease. But here's the kicker. Are these tools actually effective, or are they just a band-aid solution for a much larger problem? Diagnosis of COPD. COPD is diagnosed through a combination of medical history, physical examination, and lung function tests such as spirometry. In spirometry, a patient is asked to exhale as forcefully as possible into a tube connected to a spirometer, which measures the amount of air they can exhale and how quickly they can do so. Other tests such as chest X-rays and CT scans may also be used to assess lung function and rule out other conditions. So whether you're personally affected by COPD or know someone who is, it's crucial to stay informed. Let's spark a conversation. What are your thoughts on the current treatment options? Are they enough? And how can we raise awareness about this often overlooked condition? Treatment options for COPD. While there is no cure for COPD, there are various treatment options available to help manage symptoms and improve quality of life. These may include medications, bronchodilators, corticosteroids, and antibiotics may be prescribed to alleviate symptoms and prevent exacerbations. Pulmonary rehabilitation, a comprehensive program that includes exercise training, education, and counseling to improve physical endurance and quality of life. Oxygen therapy. Supplemental oxygen may be prescribed for individuals with severe COPD to improve oxygen levels in the blood. Surgery. In some cases, surgical procedures such as lung volume reduction surgery or lung transplantation may be considered. Management strategies for COPD. In addition to medical treatment, there are several lifestyle changes and management strategies that can help individuals with COPD better manage their condition. These may include Quitting smoking. The single most important step in managing COPD is to quit smoking and avoid exposure to secondhand smoke. Avoiding lung irritants, minimizing exposure to air pollution, dust, and fumes can help reduce symptoms and prevent exacerbations. Staying active. Regular physical activity can improve lung function, strengthen respiratory muscles, and boost overall health. Eating a healthy diet. Eating a balanced diet rich in fruits, vegetables, lean proteins, and whole grains can help maintain a healthy weight and support lung function. Personal stories and case studies. To further illustrate the impact of COPD on individuals and their families, it can be helpful to share personal stories or case studies. For example, Susan, a 65-year-old retired teacher, was diagnosed with COPD after years of smoking. With the help of her healthcare team and support from her family, Susan was able to quit smoking, participate in pulmonary rehabilitation, and improve her quality of life. By sharing stories like Susan's, readers can better understand the challenges and victories of living with COPD and feel empowered to take control of their respiratory health. In conclusion, COPD is a serious and progressive respiratory condition that requires early detection, proactive management, and ongoing support. By raising awareness about COPD, providing practical advice for individuals living with the disease, and highlighting the importance of lifestyle changes and medical treatment, we can help improve outcomes for those affected by COPD. Remember, it's never too late to take control of your respiratory health. If you or a loved one are experiencing symptoms of COPD, seek medical attention and take the necessary steps to manage your condition effectively. Together, we can work towards a future where COPD is better understood, treated, and ultimately prevented. If you found this video helpful, don't forget to like, share, and subscribe for more health-related content. Let's keep the dialogue going in the comments below. Thanks for watching and take care of those lungs.